Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. This is the first episode in a series with oncology social worker Mari Montesano. Mari is chatting with nurse practitioner Kelley Crusius about what advice she's giving her patients in the CMH-OHSU Knight Cancer Collaborative on how to navigate the questions of whether and how to gather with family during the holiday season. This is definitely a tough question for many people right now. Mari and Kelley share some great ideas on how to make this unusual holiday season special. They've inspired me to get creative with my holiday plans, and I bet they'll get you thinking too. Hi, Mari.
Hi, Felicia. How are you?
I'm good. So you were the host for one of our podcasts today, your first one.
Yes, very exciting, and I think it went really well.
Good. Well, who did you chat with?
So I got to bring on Kelley Crusius, our amazing nurse practitioner here at the Cancer Center, who sees all of our patients for medical oncology for both the providers. We discussed a question that's been coming up a lot lately, especially with our patients and their families surrounding the holidays and COVID, the pandemic that's going on, and if they should be seeing families or how they can start that conversation of what they should be doing for the holidays and seeing their families or not seeing their families.
Mm-hmm.
It's been hard because they've been isolated, so they want to see their families, but they want to be safe as well.
So what did you take away? If there was like one nugget from your conversation, what would it be?
I think just encouraging families to be open and flexible with each other and not to get upset if one family member doesn't feel comfortable seeing the other, or if they want to think of a whole new idea, like having dinner outside or just doing a Zoom call. I think just trying to be flexible with each other and just support each other with whatever people feel comfortable with.
Well, great. I'm looking forward to hearing your ideas.
Awesome. Thank you so much.
Okay, let's get to the interview.
Awesome. Hi, I'm Mari, and I'm here with Kelley Crusius, our nurse practitioner at the Cancer Center. And today I wanted to talk about holidays and COVID and our cancer patients a little bit, and then just in general, ideas for people and families to kind of navigate this new journey that we're on with the pandemic. You know, I've been hearing a lot from our patients and their families of the struggle of what to do and how to talk to their families about what to do and how to keep each other safe. So I wanted to bring Kelley on and see what she's been hearing from patients as well.
Yeah, thanks for having me, Mari. It's definitely a big topic for our patients here at the Cancer Center. They're some of the most vulnerable. That's what we heard about at the beginning of COVID, right? If you're immunocompromised or elderly, you're at a higher risk, and a lot of our patients are both. And so they have a lot of questions about, how do I see my loved ones at the holidays? What's safe? What isn't? Do I even see my loved ones at the holidays? And so that's a lot of what we've been talking about. I'd say I talk more now about COVID than I do about cancer in most appointments.
Yeah, it's definitely a high topic. What have you been telling our patients?
So it really is on a case-by-case basis. We have some basic recommendations from the CDC, right? Like, we know that it's not safe to gather in large groups with people from outside of your household. We know that wearing masks is efficient and safe. We know that hand washing is important. And we also know that one of the higher risk activities is sharing a meal with others. We have our mask off, we're eating, we're chatting, we're spraying germs around. And so I talk with patients about all of those risks. But there's another important thing that our patients in particular have to weigh, and that is this my last holiday? And the risk of infection versus missing time with family when possibly this is your last Christmas or Thanksgiving or New Year's or birthday, whatever it is.
Totally.
So that's something I try to weigh on a case-by-case basis.
Yeah, and we want to make sure that they get that quality time with their families, still safely, but also, you know, weighing what's the most important right now. And isolation is really hard on our patients and just families in general right now. So making sure we're balancing still getting that time. I know that I have an 88-year-old grandfather, and my parents have, tried to give him all the information possible to keep him safe and let him make the decision on what he wants to do for the holidays. And he decided he didn't want to be with the family, and he would do Zoom calls with us. But he's 88, but he wanted to make that decision for himself. So I think that's what we can do for our patients, is try and give them all the information, ideas, all that we can do, and let them know it's flexible and that it's up to them. And we just have to support our loved ones with their choice on what they want to do. But we also thought of some creative ideas. So we wanted to try and share some with you all. Kelley had some really good ideas, and so we're going to share them with you guys too.
We talked about all the different ways to try to celebrate with the internet and without, because not everybody has access to the internet, right? Like, it's pretty ubiquitous, but it's tough out here. We have a lot of places in our community that don't have good access, or the internet's so slow, you're not going to have a great Zoom call anyway. So we talked about doing like a recipe exchange where everybody cooks the same recipe. And then if you're close enough, you can drop it off and have a competition of who cooked it best. Did you make grandma's cookies the best, or did I do it? Or, if you are the family member who has all the recipes and you're the repository, maybe finally sharing some of those secret recipes with your family, and everybody taking a crack at different ones and sharing the same meal, but maybe not at the same table.
Yeah. Or, even especially if you don't have the internet, calling them and just setting the phone on speaker and having a dinner together and still being able to have that conversation. Is just a safer way to have a conversation while eating dinner. Also, another creative idea Kelley thought about that I thought was actually really cool was like a tailgate type party. You can still kind of be warm in your car and have your own meal, but be around family or friends, whoever is close to you, which I thought was really creative. Or like a beach fire pit, tailgate type thing.
Yeah, if you're lucky enough to have an outdoor space and you still want to gather with people from outside your family, that is considered the safest way to do it. So if you can, find a heater or fire pit or whatever it is, and sometimes we get lucky with our weather, sometimes not, and share things together that way, that can also be another way to gather.
Hey there, it's Felicia. Thanks for listening. I'd love to include your questions or comments in an upcoming episode. To leave me a message, please call 503-338-4654. If you've got a health question, I'll do my best to get you an expert answer. Again, that number is 503-338-4654. Now let's get back to our guest.
Yeah, and how would you, if people really wanted to get together and, they don't want to do it outside, like what can we suggest to our patients to be as safe as possible, knowing the risk still, but what are things that they could do in their homes to still have guests but keep themselves safe?
Hand washing is key, and masks are key. So wear the masks for as long as you can. When you are eating, staying 6 feet apart is the best, and really staying 6 feet apart from anyone who isn't a part of your household is a part of the current CDC recommendations. If anyone doesn't feel well, they really shouldn't come to dinner. And the list of COVID symptoms is ever changing, and CMH has information about it on our website, or they're welcome to call the clinic or their primary care doctors to find out more about, do I need to be worried about this sinus headache or this tummy ache, or am I okay? And we're always happy to guide patients through that. But following the guidelines are key. You also can not share utensils, and maybe everybody makes their own plate, separate plates, things like that, rather than the big buffet style where everyone's leaning over each other and in close proximity.
Yeah, and even maybe making sure tables are spread out, maybe per household, everyone from the same household sits at the same table, just so then when you are unmasked eating, you're with the people that you're already exposed to. So what would you say to a patient or a loved one that asks if their loved one or themselves could get a test before the holiday and then self-quarantine, of course, after the test, and then go see their families? What would you say to them about that?
So there's a lot of challenges surrounding testing in general. Mostly testing is only available to those that are symptomatic, but if someone is able to get a test, that doesn't mean you don't have coronavirus. Unfortunately, nothing's 100%. And there is a false sense of security that we get with those swabs, but you could become infected after your testing and still pass that because there's an incubation period of 10 to 14 days. You could be at the beginning of your illness and it just didn't get picked up on testing. So a negative test does not mean that you're free and clear. If you were able to get a negative test at the beginning of quarantine and then quarantine for 14 days and see a family member, that is a safer way to go if that's possible.
Awesome. Thank you. But I think, this is a new year and a new way to start some new traditions with families. And even families that you don't usually see at the holidays, you could connect with via the phone or mail or, obviously the virtual aspect is huge right now, FaceTiming or Zoom. But I think it's definitely a new time to start those new traditions. And I think, that's the positive way we can try and look at this new holiday that we're going through, as it can be very isolating and hard for loved ones to get through anyways.
The bottom line is that we have hope that this is just this year. So one tough year so we can all have a better year together next year is, it's a sacrifice, but it's one worth making.
Definitely. And I think these are hopefully some ways to make it a little better. My family is choosing to, for Thanksgiving, we did a huge Zoom call, and for Christmas, we're going to do another big Zoom call. We're all going to have a specialty drink and then just toast to the new year and new beginnings and what we're thankful for. So I think if we can hold on to those things, then we can all get through this difficult time together.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.